In the vast expanse of human endeavor, we launch programs, we initiate projects, we invest immense financial resources, we invest immense human resources with the hope of creating positive change. These are our starships, sent out to explore social improvement, educational advancement, public health. Yet how do we truly know if they have reached their destinations? For decades, the field of evaluation has served as our primary navigation system. It provided tools to measure progress, to chart courses, to understand the impact of our interventions. But like early astronomers who could only see the brightest stars, our methods missed subtle forces. We have been limited by our instruments, capturing only a fraction of the full story. The universe of programmatic impact is not a simple linear system. It is a complex, dynamic web of interactions, feedback loops, and emergent properties. To venture into this new territory, we needed a clear set of coordinates. Our exploration was guided by fundamental questions, not about tweaking existing models, but about challenging their foundational assumptions. A question that probes the very nature of causality in social systems. First, how can we move beyond linear models of attribution? And how can we map multi-directional, non-linear causal pathways? This forced us to stop asking, did the program work? And instead ask, how did the system change after the program? A star's evolution is inseparable from its galactic environment. Likewise, outcomes are entangled with social, economic, political context. Third question, how can frameworks capture emergent properties and temporal dynamics, including time lags, tipping points, and unintended consequences? Finally, bridging theory and practice. A framework must be usable on the front lines. We needed a user manual. These four questions formed the constellation that guided our research journey. To answer these ambitious questions, a single conventional method would not suffice. We needed to construct a multifaceted methodological telescope, combining different lenses to capture a more complete picture of reality. Our approach was a multi-case, mixed-methods comparative study design, much like astronomers using different wavelengths to study a distant galaxy. We selected 6 distinct social programs to serve as our celestial objects of study. The first lens was qualitative systems mapping. For each case, we did in-depth interviews with a wide array of stakeholders and asked them to map the system as they saw it. Using specialized software, we aggregated these mental models into a collective systems map, letting us see the system's dark matter. The second lens was quantitative network analysis. We assigned weights to connections and moved from descriptive to analytical models. Finally, agent-based modeling integrated these streams. We ran what-if simulations, different decisions, external shocks, changes in funding, turning evaluation forward-looking. So, peering through our newly constructed telescope, the universe of evaluation looked, well, profoundly different. The most significant discovery was the prevalence and power of what we call impact cascades, second, third, and even fourth-order effects that just cascaded through the system. In one workforce program, the most significant impact was an unintended peer support network. Our data showed that over 60% of the total measured positive change was attributable to these indirect cascades. Another key finding relates to contextual gravity, a powerful force that could bend the trajectory of an intervention. Context accounted for 45% of the variance. Programs with short, effective feedback loops were vastly more effective and resilient. High adaptive capacity maintained over 80% of their effectiveness under shock. Finally, hidden leverage points. Places where a small shift produces big changes. In public health, trust between community and providers yielded a 300% greater return versus equivalent spend on supplies. The discoveries made through this research are not just interesting observations, they are a call to redraw the map, from evaluation as judgment to evaluation as learning and adaptation. New evaluator competencies in facilitation, systems thinking, developmental dialogue. Impact cascades mean funders must move beyond narrow KPIs toward flexible, trust-based models that reflect the nonlinear nature of change. Integrate complexity science into evaluator training. Feedback loops, emergent properties, network theory, agent-based modeling should be core components. This research gives a clear framework, quantum impact dynamics, QID, as the cornerstone bridging theory and practice. Revealing the hidden mechanics of change reveals new levers for impact. Change can be precise, strategic intervention, not always monumental effort. Read and cite the paper in the American Journal of Evaluation, or access it directly at https://doi.org/fake/aje.2025.qid.paper.